Hello everyone, my name is Latoya Gibson and I will be presenting my Vulnerable Populations presentation on uninsured women living in rural areas. In 2010, according to the U.S. Census Bureau, 19.3% of Americans reside in rural communities. The U.S. Census Bureau does not specifically define the term rural, but does include definitions for areas that are considered urbanized clusters. Any area that does not fall into that category, therefore, is considered rural. According to the U.S. Department of Health and Human Services, they utilize specific indicators in which they define a rural area. These indicators would include low population size and density, distance from urban areas, low degree of urbanization, and also an area in which there are few types of economic activity. The rate of uninsured Americans in 2009 was approximately 50 million individuals. Individuals that live in rural areas are more likely to be uninsured, especially those living in more remote areas. During the years of 2004 and 2005, the rate of the rural uninsured was 23% as compared to 19% of the urban uninsured. Factors that contribute to this include lower socioeconomic status, poor physical health, being self-employed, as well as employment for small companies. As compared to their urban counterparts, rural residents tend to be older, have a lower income level, have poor physical health, and more chronic medical conditions. Health disparities among this group would include premature mortality or death before the age of 75. They also have a higher rate of unintentional injuries, suicide, chronic obstructive pulmonary disease, cigarette smoking, cardiovascular disease, higher death rate from cancers, as well as chronic health conditions such as arthritis, diabetes, and hypertension. Another disparity among this population is that they are less likely to participate in preventive health services. This is likely due to the lack of health insurance as well as additional barriers to accessing care. These barriers would include longer distance required for travel in order to obtain healthcare services, the lack of healthcare professionals that actually practice in these areas as well, and also lack of education among these individuals. A special health concern for uninsured women that live in rural areas is the lack of utilization of screening mammography. Between the years of 1993 and 2005, mammography rates were found to be the lowest among ladies who did not have insurance, with that rate being 38.3%. This would contribute to individuals being diagnosed at a later stage of disease, thereby increasing mortality rates from breast cancer. In order to alleviate this problem, effective strategies must be put into place that will encourage the use of preventive services among this group of individuals. In an attempt to overcome barriers to access to care and to also encourage the use of preventive services among ladies that live in rural areas, this leads to the development of my clinical question, which is, will the quarterly addition of a mobile mammography unit to an existing breast health program improve compliance rates in uninsured women residing in rural areas? In order to improve the likelihood of survival from breast cancer, regular screening with mammography is essential. Mammography is considered the gold standard for screening for breast cancer, especially in early stages of disease. Mammography is able to detect tumors 1 to 3 years before they are palpable on clinical exam. One way of improving access to these services is by the use of mobile mammography. Mobile mammography has been used for over 2 decades in order to improve access to these services. Not only has mobile mammography shown to improve access, but compliance rates have also demonstrated an improvement in these individuals that utilize this service as well. A special population of interest that has demonstrated definite benefits from the use of mobile mammography are rural residents. Patients that qualify for this service would include any individuals that are serviced in the areas that the breast health program specifically targets. Also, those in the surrounding areas and surrounding communities are welcome also to participate. These individuals must be uninsured, at least 40 years of age, must not have any pre-existing breast concerns, and they must have had a normal clinical breast exam within the 3 months prior to the mammogram, or they will have a normal breast exam performed on the day that the mammography is actually performed. The interdisciplinary team will consist of an advanced practice registered nurse, a radiologic technician, a radiologist, as well as a driver of the mobile unit. The advanced practice nurse will serve to take patient histories. They will also perform the clinical breast exams for any individuals who are in need of one prior to the mammogram screening. The radiologic technician, of course, must be experienced in performing mammograms in order to decrease the likelihood of having to repeat an exam or a test. The radiologist will serve to interpret the mammogram findings. The driver of the unit can assist in registering patients as well as attending to any technical issues that may arise on the mobile unit. Patient services on this day will include a clinical breast exam to all of those ladies who are not current. After their clinical breast exam is performed, they will then receive the screening mammogram. In addition to this, they will also receive education regarding breast health. Mobile mammography units have been shown to be even more effective with the addition of education. This education will consist of normal breast anatomy. It will also consist of signs or symptoms of an abnormality, recommended screening intervals, as well as ways in which one can reduce their likelihood of developing breast cancer. Stakeholders of the proposed intervention include the current and future residents of the rural areas that are serviced, the participants of the program, including the advanced practice registered nurse, the radiologic technician, the radiologist, as well as the driver of the mobile unit, St. Luke's Mobile Medical Ministry, who provides the pre-existing breast health program currently, Susan G. Komen of Shreveport, who provides the grant in order to offer the clinical breast exams and the services that are provided as well. Also, local media, sponsors, and state and local officials who have an interest in this particular program, service stakeholders as well. The main barrier to mobile mammography units is going to be cost. Most mobile mammography programs are actually sponsored by philanthropic support. In order to overcome these barriers, I've suggested several interventions. The first would be, of course, grant writing. According to Healthy People 2020, two of their objectives would be, one, to improve the access of quality healthcare services, and also to decrease the rates of female breast cancer death. These may be utilized as platforms in order to do the grant writing. In addition to that, public campaigns, grassroots funding may also be done as well to raise money for the specific purpose. Utilizing volunteers instead of paid staff may also decrease the cost associated with performing the intervention. The smallest teams possible in order to effectively carry out the intervention should be used. The rental of a mobile unit early on in the program as opposed to purchasing one may also save cost. In addition, the use of digital technology as compared to analog film reduces some of the costs associated with actually performing the mammogram as well. In addition to cost, lack of resident participation may also pose a challenge to implementation of this program. In order to combat this, early and persistent advertising should be done. This may be done through local media outlets, through the mailing of flyers or pamphlets. Also, by posting signs or posters at the more common areas of the community can also be suggested. During the current program in which only clinical breast exams are offered, patient education should be given regarding the importance of following up with a screening mammogram. Also, these ladies that are encouraged to come back or who are scheduled to come back should encourage their friends and family members who are of age and who have not received a mammogram within the prior year to come as well. The advanced practice nurse practitioner must be culturally sensitive. They must also demonstrate a non-judgmental attitude. It has been found that among individuals in rural communities, ethnic and cultural differences may shape the importance that one feels or the importance that one perceives a test having. If someone does not perceive that this is an important test, then they will not have it done. Lastly, you can even utilize the use of incentives. If local vendors, including grocery stores, gas stations, want to offer free services such as gas cards, such as free gift cards for shopping, this can be also utilized in order to increase or to improve the resident participation. The quality of the intervention may be evaluated by the rate of client participation. Also, questionnaires may be used in which the patients are able to rate the quality of services that they received. They're also able to make recommendations for any changes that they would have for future programs. Effectiveness of the overall intervention is performed by comparison of compliance rates. Compliance rates from individuals who were referred previously through the program that only offered the clinical breast exam on site and referred for mammograms will be compared against the percentage of individuals who actually received mammograms through the intervention that's been performed. It has been shown that more than 200 million people in North America, or 77%, have internet access. Nearly 80% of individuals own a cell phone, and of this 80%, 73% participate in text messaging. These may be methods in order to improve compliance rates or also to help improve the success of this intervention. Since so many individuals have easy access to the internet, healthcare providers should encourage these individuals to choose reputable sites in order to find their information regarding breast cancer information as well as screening recommendations. They should be led towards sites such as Susan G. Komen, the American Cancer Society, the National Cancer Institute, as well as the National Breast Cancer Foundation. In addition to internet services, technology may also be used in the form of text messaging. Text messages can be utilized in order to send out messages regarding breast health facts. Text messaging may also be used in order to remind individuals that have previously scheduled their mammograms to keep their appointments. This concludes my presentation on my vulnerable population of choice, which are uninsured women residing in rural communities. I thank you again for